And how can you manage to have the private sector as public providers through contract? We have public contract. All the contracts with the private sector in Brazil are made based on the public right, the public law. So they are included. They receive a payment as a national payment, not per capita, no? But per production of services. No? But it was an option we made. In order to have a primary healthcare network as the base of the system, we provide the financing for the primary healthcare and for health surveillance for the local governments in order to generate state-owned, local state-owned facilities. It was the way. So we have a quite plural hospital facilities and specialized service, combining state-owned and non-state-owned. But on primary healthcare, we are basically state-owned. No? And it's permitted to introduce a kind of base of access for people who know the territories. It was quite interesting in the moment we did that. But there are some contradictions in that. This is not very easy because in a certain way, we abandon the emphasis on the development of the hospital facilities. And we left a lot for the private sector, non-profit specifically. But anyway, I think it's very important to understand that when we adopt this kind of public dimension-based system that's not all state-owned, you are obliged to have a very good and clear investment policy to expand the state-owned facilities. Because otherwise, you will be dependent of the private sector that is contracted. I don't know if it's clear. And then it will make a lot of pressure in terms of cost and price. Huh? So you need to have basically a very state-owned, powerful structure to introduce the regulation of the market and to say, no, you are asking too much money for that, pressuring over the national chart of values, so we will exclude you because I can keep under pressure, but I can keep the healthcare with state-owned facilities. Is it clear? It's very important otherwise. Otherwise, especially in case of introduction of new technologies, you are very much fragile regards the possibility that the private sector will have to promote the introduction of new technology, whatever. And in this case, this system needs to be the leading force in the introduction and the regulatory initiatives in terms of technology. Otherwise, you'll be all the time submitted to the interests of the markets and the pressure of the people. Huh? That's the point, because people having some more money, they ask for better quality. And they are seduced by some aspects of the private sector that continues to exist. No? So we need to control this through a very clear and transparent... I finish.